Emily Daniels, a 32-year-old white nurse, has been working at Riverside General Hospital for nearly a decade. With her sharp features, always pristine white uniform, and a no-nonsense attitude, she is the epitome of efficiency in a bustling healthcare environment. Despite her dedication to her profession, Emily harbors a quiet resentment born of personal struggles. Recently divorced and juggling the demands of her job and single motherhood, Emily often finds herself overwhelmed. The relentless pace of her workday leaves little room for empathy, and her patience has worn thin. Compounding this, she unconsciously carries biases shaped by her upbringing in a predominantly white suburban community. These biases manifest subtly: assumptions about patients' socioeconomic statuses, implicit judgments about their behaviors, and an occasional coldness toward those who don't fit her unspoken expectations. Her routine is rigid, beginning with a strong coffee at the hospital cafeteria and a glance at the day's patient roster. She prides herself on her efficiency, but her approach often lacks warmth. For Emily, every interaction is a task to be checked off, a mentality born of necessity, but one that isolates her from truly connecting with the people she serves. Miles Carter, a successful entrepreneur in his late 40s, enters the hospital with an air of quiet confidence. Standing tall with a warm smile and an unflappable demeanor, Miles exudes a sense of purpose that commands attention. His polished appearance, a tailored suit, neatly trimmed beard, and expensive watch belies the challenges he has overcome to reach his current station in life. Growing up in a working-class neighborhood, Miles faced systemic barriers and racial prejudice from an early age. These experiences forged his resilience and determination, pushing him to defy expectations and build a multi-million-dollar real estate empire. Despite his success, Miles has remained grounded, driven by a commitment to uplift others who face similar struggles. This visit to Riverside General is personal. His wife, an active philanthropist and advocate for maternal health, has urged him to oversee the hospital's initiatives for underserved communities. But today, Miles has come incognito, wanting to experience firsthand the quality of care offered without his influence being known. His calm demeanor masks a steely resolve to uncover any disparities in treatment and address them head-on. Riverside General Hospital is a sprawling, labyrinthine building that hums with relentless activity. The bright fluorescent lights cast a stark glow on the polished linoleum floors, reflecting the hurried footsteps of doctors, nurses, and visitors. The air is thick with a mingled sense of antiseptic and overbrewed coffee, punctuated by the occasional beeping of medical equipment and the murmur of voices from crowded waiting rooms. The hospital is a microcosm of the city it serves, with patients and staff from diverse backgrounds converging under one roof. However, beneath the surface, a silent tension pervades. The hierarchical structure of the institution is palpable, nurses rushing to meet doctors' demands, administrators juggling resources, and patients often feeling like they are navigating a maze of bureaucracy. The emergency department, where Emily works, is particularly chaotic. Stretchers line the hallways, occupied by patients ranging from the critically ill to those with minor injuries. Nurses dart between beds, charts in hand, while doctors deliver rapid diagnoses. In this high-pressure environment, time is of the essence, and decisions are often made on the fly. Yet, the atmosphere is not without its cracks. Subtle inequities reveal themselves. Patients with better insurance are often attended to more promptly, and those perceived as difficult are subtly sidelined. Emily has become adept at navigating these unspoken rules, but her efficiency often comes at the expense of compassion. It's a particularly hectic morning when Miles enters the hospital. Emily, preoccupied with a backlog of cases, barely glances up as he approaches the front desk. His understated demeanor and casual tone do little to draw her attention. She dismissively hands him a clipboard with a curt directive to fill out the necessary forms and wait. Unbeknownst to Emily, this seemingly ordinary interaction will set the stage for a revelation that will shake her to her core. The calm confidence in Miles's eyes hints at a depth she doesn't perceive, while her brusque manner is rooted in assumptions she has yet to confront. As Miles takes a seat in the crowded waiting area, he observes the staff and patients around him, noting every detail with a keen eye. His intent is clear, to understand the system from within. Emily, oblivious to his true purpose, continues her rounds, unaware that her next actions will be scrutinized and, ultimately, challenged. The automatic doors of Riverside General Hospital slid open as Miles entered, his confident stride momentarily halted by the scene of bustling activity. Clutching his medical paperwork, he approached the reception desk where Nurse Emily Daniels stood, her focus firmly on the screen in front of her. Without looking up, she gestured toward the clipboard and instructed, "Fill this out and take a seat." Miles complied, his demeanor calm but observant. As he completed the form, he couldn't help but notice Emily's hurried tone with other patients, particularly those who seemed less affluent or spoke in accented English. Still, he reserved judgment, knowing this visit was an opportunity to gauge the system without his influence being known. Minutes turned into an hour as Miles waited patiently. Eventually, he approached Emily again, pointing out that his condition might warrant faster attention. She gave him a once-over, her tone clipped. "You'll be seen when it's your turn. We're understaffed, and everyone here thinks they're urgent." Her words, though professionally neutral, carried an edge that stung. Miles detected an implicit judgment in her eyes, one he had encountered before, a dismissal born of assumptions about who he was and what he deserved. Miles's initial reaction was one of quiet disbelief. He had entered the hospital expecting professionalism and compassion, not the cold indifference he now faced. Taking a deep breath, he calmly stated, "I understand it's a busy day, but I was told by my doctor that this issue could escalate if not addressed promptly." Emily barely hid her irritation, her response laden with impatience. "Everyone here thinks their case is critical. You'll just have to wait like everyone else." Her tone silenced the waiting room briefly, drawing the attention of nearby patients and staff. Frustration simmered beneath Miles's composed exterior. He debated whether to reveal his true identity or continue observing the dynamics at play. "I see," he replied, his voice steady but firm. "I'll wait a little longer, but I'd appreciate it if you could check on my paperwork. It might help speed things along." Emily rolled her eyes subtly, but before she could respond, another nurse intercepted. "Emily, we're getting complaints about delays. Maybe we should review some of the forms more carefully." The interaction left Miles shaken, not because of the wait, but because of the systemic lack of empathy he was witnessing firsthand. The tension between Emily and Miles did not go unnoticed by others in the waiting area. Several patients exchanged glances, their expressions a mix of sympathy for Miles and annoyance at the hospital's inefficiency. A mother with a crying child muttered, "They're always like this here," while an elderly man shook his head in silent disapproval. The ripple effects of Emily's demeanor began to disrupt the flow of the department. A junior nurse, visibly nervous, hesitated to approach Emily for guidance, opting instead to handle a patient's query herself. This added strain to her already demanding workload. Meanwhile, Dr. Sarah Blake, a compassionate and sharp-witted physician, emerged from her office, noticing the growing restlessness among patients. "What's going on here?" she asked, her tone both curious and commanding. Emily brushed off the question, citing a surge in patient intake, but Sarah wasn't convinced. Her gaze fell on Miles, who had returned to his seat, radiating calm despite the apparent mistreatment. Something about his composure caught Sarah's attention. "I'll review his case," she said, making a mental note to address the underlying issues in the department later. The stage was now set for a confrontation that would challenge assumptions, reveal hidden truths, and force all parties involved to reevaluate their roles within the system. Miles's patience was wearing thin. When Nurse Emily walked by without acknowledging his second attempt to gain attention, he decided it was time to assert himself. Rising from his seat, he approached the desk once more, his tone polite yet firm. "Excuse me, nurse. I've been waiting for over 2 hours. I'd appreciate it if my condition could be reevaluated for priority," he said. Emily sighed audibly, her irritation now on full display. "Like I said earlier, we're busy. You're not the only patient here. If you can't wait, perhaps another hospital would better suit your needs." The condescension in her tone triggered murmurs among nearby patients. Miles's calm expression hardened, and his voice took on a quiet but unmistakable authority. I respect the challenges you're facing, but your lack of empathy isn't helping anyone. Emily's face flushed. She opened her mouth to retort, but before she could, another patient interjected, "He's right. You've been rude to everyone all day." The atmosphere in the room shifted, and Emily's discomfort became palpable. The junior nurse who had hesitated earlier decided to step in. "Emily," she said softly, "maybe I can handle this patient's case? We don't want unnecessary delays." Emily glared at her colleague, but nodded curtly.
"Fine."
"Do whatever you want," she muttered. Meanwhile, Dr. Sarah Blake emerged again, drawn by the rising tension. Her eyes quickly assessed the room and landed on Miles. "Sir, would you mind explaining your situation to me directly?" she asked. Miles's face softened at her professional tone. "I have a pre-existing condition that requires monitoring. I've already submitted all the paperwork, but it seems there's been a delay." Dr. Blake nodded, her voice calm but firm. "I'll look into it immediately." She cast a pointed glance at Emily, who quickly busied herself with another task, avoiding eye contact. Other patients began whispering among themselves, emboldened by the doctor's intervention. "About time someone did something," a woman murmured. As Miles waited for Dr. Blake to investigate, he reflected on the moment. Years of navigating subtle and overt prejudices had taught him resilience, but each encounter carried its own weight. This wasn't just about him, it was about the countless others who lacked the voice or confidence to stand up for themselves. He glanced around the waiting room, noting the diversity of faces, each one likely with their own story of struggle. His resolve solidified. Whether or not anyone recognized him as the hospital's owner didn't matter right now. What mattered was holding people accountable and creating a system where everyone received the care they deserved. In that moment, he realized that this incident wasn't just a personal affront, it was an opportunity to make a change. He silently vowed to ensure this hospital became a model of equitable and compassionate care. Dr. Blake returned with a clipboard and an apologetic smile. "Mr. Miles, your case is indeed urgent. I've instructed the staff to prioritize your treatment." Miles thanked her sincerely, his calm demeanor masking the brewing storm beneath. As Emily observed this interaction from afar, a flicker of doubt crossed her face. Who was this man, she wondered, to command such immediate attention from one of the hospital's top doctors? The waiting room buzzed with speculation. "Did you see how the doctor rushed back?" someone whispered. "He must be someone important." Emily's discomfort grew as the whispers turned into murmurs of curiosity and judgment. The tension was now palpable, setting the stage for a revelation that would change everything. The tension in the waiting room reached its peak as the doors to the administrative wing opened. A tall, sharply dressed man in his late 40s entered, flanked by two assistants. His presence immediately commanded attention. Dr. Blake rushed to greet him with a mix of deference and urgency. "Nathan, I'm so glad you're here," she began. "We've had an incident involving one of our valued patients." Nathan Miles nodded, his calm demeanor betraying no trace of frustration. He scanned the room, his gaze landing on Emily, who froze as realization began to dawn. "Mr. Miles," Dr. Blake continued, "let me formally introduce Nurse Emily Carter. She's part of our triage team." Emily's face turned ghostly pale as Nathan stepped forward and extended a hand. "Miss Carter," he said, his voice calm and measured, "I believe we've interacted earlier today. You seemed quite busy." The weight of his words hit her like a freight train. The murmurs in the waiting room intensified as patients pieced together what was happening. "Nathan Miles," Dr. Blake clarified, "is the owner of this hospital and its affiliated facilities across the region. He's here to assess patient care standards firsthand." Emily's heart sank. The man she had dismissed, spoken down to, and openly ignored wasn't just a patient. He was the hospital's benefactor, the person responsible for her livelihood. Nathan turned to address the waiting room. "I came here today to experience the level of care provided to every patient, regardless of their background or appearance. Unfortunately, I've seen areas that need significant improvement." He glanced back at Emily. "Miss Carter, I believe you made assumptions about me that influenced your behavior." In doing so, you not only disrespected me but also failed to uphold the standards of this hospital." The room fell silent. Emily's eyes welled up with tears, her regret evident. Emily's mind raced. Every interaction with Nathan replayed in her head, each word now a testament to her bias and unprofessionalism. She felt exposed, vulnerable, and terrified of the consequences. I didn't know," she stammered, her voice barely above a whisper. "That's precisely the issue," Nathan replied gently. "You shouldn't have to know someone's status to treat them with dignity and respect. Everyone deserves the same level of care." Emily nodded, her voice breaking. "I'm sorry. I don't know what else to say." Nathan regarded her for a moment, then turned to Dr. Blake. "I trust you'll review the necessary policies and provide additional training where needed. This isn't about punishment. It's about ensuring no one else experiences this." His composure and grace left a profound impact on everyone present. Emily, though overwhelmed by guilt, felt a small flicker of hope. Perhaps this moment of reckoning would lead to personal and professional growth. Nathan Miles stood in front of the hospital's assembled staff, his tone firm but compassionate. What happened today isn't just about one person's actions. It reflects systemic issues that must be addressed. He turned to Emily, who had remained silent throughout the meeting, her face a blend of regret and determination. "Ms. Carter," Nathan continued, "what matters now is what we all learn from this experience." Emily swallowed hard and stepped forward. "Mr. Miles," she began hesitantly, "I deeply regret my actions and the assumptions I made. I want to make this right, not just with you, but with everyone I've failed in the past." Nathan nodded. Acknowledgement is the first step. But this isn't just about apologies, it's about action. We're implementing mandatory sensitivity training for all staff and revisiting our protocols to ensure no patient is overlooked or mistreated again. The room erupted in murmurs, a mix of relief and determination spreading among the staff. Over the following weeks, Emily took part in extensive sensitivity training and volunteered to lead workshops for new nurses on the importance of empathy and cultural competence. She sought out conversations with colleagues from diverse backgrounds, listening to their experiences and learning from them. Her transformation didn't go unnoticed. Colleagues who had once dismissed her as rigid and unapproachable now saw someone striving to grow. Emily even approached Nathan privately to thank him for his patience and to ask for his guidance on further self-improvement. Nathan's response was kind but candid. "Growth is a continuous process, Emily. What matters most is that you remain committed to treating everyone with respect, regardless of their background." Nathan found himself reflecting on the day's events as he walked through the hospital's corridors. He had always been proud of his accomplishments, but moments like this reminded him why he had invested in healthcare, to create spaces where every person, regardless of race or status, felt seen and valued. As he passed the waiting room where the confrontation had occurred, he paused. The room was empty now, a stark contrast to the chaos of that morning. Yet, it seemed brighter somehow, as if the air itself carried the promise of change. Nathan smiled softly. Change, he knew, was never easy, but it was always worth pursuing. In the hospital courtyard, Emily stood by the garden, watching as a diverse group of patients and staff mingled. She noticed a young girl holding her mother's hand, looking up at the hospital sign with wide eyes. Emily approached them, bending down to the girl's level. "This place is here for you," she said, smiling warmly. "We'll always take care of you." The girl's mother nodded, her eyes filled with gratitude. Emily felt a small flicker of hope in her chest, a sign that she was on the right path. Nathan, watching from a distance, nodded in approval. The seeds of change had been planted, and the hospital was on its way to becoming the inclusive, welcoming place he had always envisioned. Stories like these remind us of the power of accountability and the need to challenge bias wherever it appears. If you believe in fostering empathy and understanding, hit the like button, share this story, and subscribe for more narratives that inspire change.